I'm going to ask now our next speaker in virtual terms. I was hoping to be able to introduce Françoise Grossetête to you at this point, the member of the European Parliament who's on the schedule, but she's been unfortunately detained. It's the penalty of inviting prominent members of the European Parliament. They're subject to voting regimes. There's a vote in the Parliament today. She's not able to make it. She sends her apologies. She does better than that. She sends the text of her speech. She does better than that. She has sent her own emissary. So I'm going to ask Rémy Petitot to come and join us up here and give you the summary of the remarks that Françoise Grossetête would have made herself. Rémy, please.
Thank you. Thank you very much. Once again, I would like to convey the apologies of Mrs. Grossetête, who indeed was stuck for the voting session in Parliament. She didn't expect it. She's disappointed to not being able to take the floor. But those of you who wanted to meet her will be able to do so well, this evening she will be joining us for the dinner. Well, for Mrs. Grossetête, ensuring equal access of Europeans to the best quality cares and treatment is at the core of EU competences in the health policy field. And it's also at the core of her commitments in the health sector and the work she has done in the pharmaceutical legislation. And she wanted to start with a rather bold statement, saying that after decades of rather disappointing results, the industry is now back to bringing disruptive innovation to the market. And those innovations are bringing with them incredible opportunities and challenges. Now the question is all about access and pricing, and how do social security systems actually find the resources to afford those innovations. And she's asking the question, why don't we simply shift paradigm, and instead of only talking about pricing, which for her is only part of the problem, why don't we also especially talk about how much social security systems are actually willing to afford, willing to pay to put those new technologies on the market, and how do we estimate the cost of 1 life, 10 lives, 1,000 lives? Anyway, the status quo is no longer an option, and she thinks the future of healthcare and the answers to the future of healthcare lay in four pillars. The first one is adaptability. New models are needed, more pragmatic, more flexible for the way we authorize drugs to be put on the market. Adaptive pathways and early access mechanisms, such as the scheme for temporary use authorization created in France, have paved the way, and she thinks those represent the future of pharmaceutical regulatory framework. Then the second pillar is solidarity. Social systems are based on the principle of solidarity, which must continue to be the rule. Pricing should depend, of course, on the costs and benefits of a drug for a given patient and for society at large. But solidarity also, for Mrs. Grossetête, has to be shown better between member states. On one hand, they have to better cooperate to exploit the full potential of a larger European scale. And in this way, she's very happy that the Commission is taking initiative for a common frame for HTA at EU level. She thinks that goes into the right direction. On the other hand, member states have to accept that differential pricing allows for the accessibility of treatments in least favored countries, and that's also part of solidarity. Now, the third pillar is effectiveness. A new and stronger focus has to be put on the effectiveness of new drugs, on measuring health outcomes and shifting to pricing models based on results. For her, value-based pricing is a cornerstone of this new trend and will only continue to grow in the future. Now, the fourth and last pillar she wanted to highlight is connectivity. We can't ignore the tremendous benefits and challenges that e-health and digitalizations will bring to the health arena. They will empower patients, industry, and payers with new tools, with access to data for quicker access, more targeted treatments, and lower costs in general. And the last thing she wanted to say, to conclude quickly, she also wanted to say a word about the high-level conference on global health security that took place here in Lyon last month. And she wanted to highlight that those problems and those challenges of access and those solutions, those 4 pillars, are not limited to Europe. Increased globalization has shown the growing interdependence of many actors, and we have seen with Zika, with Ebola, that diseases are no more limited to a geographical area. Unsatisfied and unmet public health needs exist in all continents, whether in developed or emerging countries. And to address them, Mrs. Grossetête thinks that we have to set the right incentives. We have to align economic incentives with global public health priorities, such as infectious disease, cancers, neurological disease, antimicrobial resistance, which is also something she has worked on. It will be crucial to ensure that groundbreaking innovation made possible by new technologies and the progresses in science quickly reach all continents. And in this regard, access will be a global challenge. So those 4 pillars should also be applied at global level. They are not only valid for Europe. Now, for Mrs. Grossetête, clearly we are at a turning point in the future of healthcare. Technologies are changing quickly, and she thinks we have to also change our mindset.